For more on this vaccine hunt, we can speak now to Yanis Natsis, the policy manager at the European Public Health Alliance NGO. He joins us now from Brussels. Thank you very much for being with us here on France 24. Progress is, of course, being made to find this much needed vaccine. But why has it taken so long to find a vaccine, and how much longer will we have to wait until one is made readily available?
Well, actually, things are going pretty fast, and I think we need to be very cautious when it comes to the speed, because the vaccine, if we get to a point where we have a vaccine, has to be safe and effective and be potentially given to billions of people. Therefore, we need to make sure that the quality, the safety profile of this product, again, if we get to one, will be safe and effective.
Now, when a workable vaccine is actually found, do we have any clearer idea of how much it will actually cost to roll it out on the scale that is needed?
That's a very good question. So far, we have indications, we have pledges from world leaders, but also from pharmaceutical companies, telling us that the end products, be they therapeutics, treatments, or an eventual vaccine or vaccines, will be accessible, affordable. There was, by a big pharmaceutical company, a €10 per unit price tag, which was mentioned in the press recently, but we are not sure. And we are not even sure what all of these pledges will actually mean in practice for the for the whole world, and not only for Europe. Therefore, I think also pharmaceutical manufacturers, but also governments, there needs to be a social contract. There needs to be an agreement that these products will be affordable and accessible to the whole world. And of course, we need to put in place now, and we need to plan now for a fair allocation and distribution system when we get to a vaccine or multiple vaccines or treatments.
Well, you've also been impressed by the way the science world has united in the face of this pandemic. How should this cooperation be harnessed and preserved in the future?
It is true that the level of collaboration, at the beginning, we saw borders closing amongst countries, but on the contrary, scientists are working more than ever before, and they're sharing information. And I think this spirit of openness, my hope is, and this collaborative approach, that this will remain, and this will be kind of the positive change that will remain in the post-COVID-19 world. We need to make sure that this open science becomes the rule, and we move away from the current pharmaceutical business model of the silos, of secrecy, of competition. It is true that companies are teaming up, governments are funding with big chunks of public money this research effort worldwide. In the European Union, we saw recently an impressive virtual pledging conference with governments across the globe donating and giving and dedicating to this fight significant amounts of money. But we need to make sure that there's a public return on this significant public investment. And we need to make sure that we have very good clinical trials, robust evidence, and not just some observational, let's say, studies. We need to be sure that when we get to the end product, we will have a good product and not just any product.
Okay, Yanis Natsis, thank you very much for being with us here on France 24.
Have a good day.